So just starting with the disease, I think there's a list of questions just about lung cancer, and then there's a list of questions about biomarker testing. In terms of the lung cancer, the first question really that always comes to mind is what is the stage, because the stage will drive the treatment. Now, stage in the past had not been relevant in terms of biomarker testing because we didn't use targeted therapies, which were the only biomarkers we used in patients with earlier stage disease, but that has changed. And so stage is still important in terms of biomarker testing. The next question is always really what's the best treatment, and that requires the question of biomarker testing. So have I had biomarker testing done on my tumor? Because you've already been diagnosed with lung cancer, which means that you've probably had a biopsy. It's been a week or it's been 2 weeks. And so sometimes when I see a patient for the first time, I already have comprehensive genomic testing or biomarker testing done, and I have it in my hand, and I can tell the patient exactly what he or she has. But in many cases, it hasn't been completed, or it hasn't been ordered. And so that's the next question. Has comprehensive biomarker testing been done? And if it hasn't been done, is there enough tissue to get it done? And how quickly can we get this rolling? Can we move along? The next question is really going to be, what is the best treatment for me? And again, that answer isn't always available on visit 1 because you don't have all the information you need. But that should prompt a conversation of what are all of the different options for lung cancer, depending on the results of the biomarker testing. In my eyes, what's very important when someone is diagnosed with lung cancer is to really be able to communicate with their doctor. So after you hear what the doctor has to say about what you have and what the treatments are available and what's possible and what's not possible, then take a look at your expectations from the treatment and voice those. Tell your doctor, this is what I want from this treatment. Can you help me get there? And the doctor will, hopefully be very honest and say, yes, I will do my best, et cetera. But it's really important to communicate that because doctors can't guess. And they're not stones either. Doctors in general care, and they want to know what people are thinking and what their concerns are.
I think the answer to the question, why don't we routinely test, is at several levels. So at the doctor level might be just the problem the doctor has so many different types of cancers he deals with. He doesn't really know how these rapid fire changes are coming for lung cancer patients. So the doctor's limited knowledge can be an obstacle. The other is that these comprehensive genomic testing, biomarker testing are often not done in-house within the hospital. They have to be ordered and the material has to be sent to specific companies. And if the healthcare system or the provider and his clinic don't have a standardized process for activating the testing, then you're left with a haphazard way and chances are people will get missed.
If the doctor is not open to answering questions and not open to doing testing or getting recommendations from a patient in terms of which direction to head, I think that it's important to find a new doctor. There are oncologists everywhere, and the majority of oncologists in the country are very good. And most of them, because of what they've been doing, because of the diseases they treat, are open to questions and are open to discussions and being partners with the patient, but there are some doctors who just don't. And so it is critical to ask those questions.
So the number one thing that I tell people, that I speak with now that are newly diagnosed is there is so much hope. Lung cancer is not what it used to be. There are so many advances now as far as treatment and biomarker testing, but there's so much more in the pipeline. I try to tell patients that lung cancer, I mean, we are very, very close to making sure that no one dies of lung cancer ever again. And that is really, really important because of how I felt when I was diagnosed. So I really try to emphasize that when I speak to newly diagnosed people, because they're, we're scared and we're frustrated and it's overwhelming. But to hear that there are these treatments, there are these pills, there's immune therapy that can really, really change the course of your lung cancer journey is so encouraging. Number two is I always emphasize how important comprehensive biomarker testing is. That's usually one of the first questions that I ask a newly diagnosed patient is, have you had comprehensive biomarker testing? And what do you know about it? And, most often, I would say even almost like 100% of the time, they don't have any idea. And so my next recommendation to them is, go back to your doctor. Like, when is your next appointment? And during that next appointment, bring it up, ask the questions. Because number one, you have to fight for yourself. It's your life, like you are fighting for your life. So any question that you want to ask your care team or your oncologist is perfectly fine. And number two, if you have a doctor that doesn't want to answer the question or doesn't want to provide you with comprehensive biomarker testing, then they're not the doctor for you. And you need to find someone that's willing to go that extra mile and to fight for you, because that is your right